This year, the NHS, which is still, I think, the unique model of universal healthcare in the world, free to every citizen at the point of clinical need, the NHS is approaching its 70th birthday. And that's been 70 years of continuous innovation and change and development. We are providing a healthcare system today that was inconceivable to our founders 70 years ago. And as we look at India, we see remarkable opportunities to extend healthcare across the population in India. Prime Minister Modi's proposal for 100 smart cities encapsulates very well the ambition that the Indian government has for healthcare and for technology across India as a whole. So it's a huge privilege to be able to bring to India a group of 18 organizations, including NHS trusts and hospitals from England, to be able to help to understand how we can work together. It's learning always, I find, on both sides. Experience from the UK, experience from India. How do we bring together and bring about those connections between people who have a really profound interest in improving the quality of healthcare in these two countries? Do you know, I'm really excited about the Createch Summit because I think the opportunity for us to bring an NHS healthcare-oriented team into central ground in the Createch Summit is a fabulous opportunity. So we'll be bringing 14 organizations, selected suppliers of healthcare technology, plus trusts who are using them and developing their own technology into the foreground for Createch. And I think it's particularly interesting that we have the opportunity with Prince Edward and with other senior dignitaries from the UK to be able to outline what it is the NHS and its partners can do, not only here in the UK, but actually in India with new partners and new contacts there. The NHS has been a leader in developing healthcare technology. We can see ECGs, CT scans, MRIs, stem cell work that's currently going on in several centres across the UK. And so it's a combination of actually developing new technologies, but it's also rolling them out in a complex healthcare system serving an entire population. And not just new technologies, but new practices, new ways of doing things. For example, whole population health screening, to try to concentrate on the health of the population and not simply the work that goes on in our very well-equipped modern hospitals. So I see the future as being a continuation of that, using in particular data to better understand through genomics and other technologies the human condition. I see analytics and the way in which we can use large data stores to inform us using international sources of data in healthcare. And of course, data and analytics are major success stories within India. And then building on that, I think one of the most significant current developments in healthcare globally is the use of artificial intelligence. We know that computers can learn very accurate models of pattern recognition. So for pathology and radiology, they can start to match the competence of very skilled clinicians. And some of our hospitals in the UK have been advanced in looking at in terms of eye disease with 3D optical scanning, in terms of acute kidney injury in the case of some of the hospitals in London, in drawing together data points from across the whole sources of data within a hospital to better inform clinical decisions. So it's a process which is never ending. There's no doubt at all that technology will provide a very different model of healthcare in the future from that which we've inherited 70 years ago and from that which we are using even today. I think there are huge opportunities for collaboration between the UK and India on technology because, frankly, no healthcare system in the world is going to progress over the next decade without investment and rollout of technology. It will transform everything that we've done. It takes us from being a system of intuition, science, and artistry into be something that's much more precise, We can see now with the technologies available to us rolling out models of precision medicine, which wrap themselves much more around each individual patient and get away from some of the hit and miss qualities of much of historic healthcare. So India, I think, has this great opportunity to work in collaboration with hospitals and with providers of technology within the UK in order to bring these two nations closer together and to draw on the resources that India has in the areas particularly of data and of analytics. So we have innovative models of design and build of healthcare facilities, which have been evident within the NHS. We've got innovative models of systems that create much more empowerment for patients to not only monitor their own conditions, but to look after their own health, often remotely, through special devices that are wearables. We've got these burgeoning technologies around what we sometimes call the omics, by which we start with genomics, but we may include proteomics, biomics, metabolomics, etc. And I have to say, these are still unfocused and uncrystallized in our thinking here, but are developing at a pace that 10 years ago we couldn't have even started to dream of. So the opportunities to deliver in concert with Indian partners for the benefit of populations both in India and the UK, I think, are almost unlimited. We've got some physical expressions of this. The turning of the ground now to create a new hospital at Nagpur is a really good example. I think the other way around with the assistance of health education in England has been the training of nurses from India coming to the UK to complete part of their training and to contribute to what we're doing in the NHS, whilst also delivering higher level of skills for specialist work back in India. So they think emerging between these two countries, opportunities for self-supportive, integrated, but highly innovative work, which will work for the benefit of our patients. The collaboration with the hospital in Nagpur is with the Indo-UK Institute of Health, and I anticipate that it will be the first of many. And at this stage, all we can say is, let's press this forward and let's bring about a significant physical manifestation of what the UK can be doing with its Indian partners.